I'm Mark Skinner, Dean of Humanities and Social Sciences at Trent University. I'm the co-principal investigator of the Improving Social Inclusion for Canadians with Dementia and Their Carers through Sharing Dance project. This project is a 4-year study looking into implications of Canada's National Ballet School's innovative community dance program in rural regions of Ontario and Manitoba. It's generously funded by the Canadian Institutes of Health Research and the Alzheimer's Society of Canada, with support of the Canada Research Chairs program.
Hello, my name is Rachel Herron. I'm a Canada Research Chair in Rural and Remote Mental Health at Brandon University, and I'm a co-principal investigator on the Improving Social Inclusion for Canadians with Dementia and Carers through Sharing Dance project. And so we actually have 3 objectives of this project. First, we really want to understand the experiences of older people living with dementia and carers participating in the Sharing Dance program, particularly as it relates to social inclusion. Second, we want to assess the effectiveness of the remote delivery of the Sharing Dance program, particularly as it relates to social inclusion. And third, we want to identify challenges in expanding or scaling up the Sharing Dance program to help further address barriers to social inclusion. It's important to fund research on dementia and social inclusion because we need evidence of promising practices and programs that enrich the lives of people with dementia and their carers, and ultimately address challenges of social exclusion.
My name is Rachel Barr, and I'm the Director of Research and Health at Canada's National Ballet School. Sharing Dance Older Adults was created to facilitate accessible dance opportunities for older people. Specifically, we wanted to create opportunities for older people who wouldn't be able to access traditional dance programs. And for this reason, we were really considering older people living with physical and/or cognitive challenges when we created the program. For me, there have been a lot of really exciting findings from this study. But I think one that really stands out for me and excites me is the way in which the program, even when delivered remotely, has been able to facilitate social engagement among the participants. This is something that maybe we weren't sure about when we began because it is being delivered through a television screen or a projector. But I think the findings from this study really capture how the on-screen dance teacher is able to support and inspire engagement amongst its participants, even if the dance teacher isn't physically in the room.
My name is Pia Cantatos. I'm a senior scientist at KITE Toronto Rehabilitation Institute University Health Network and professor in the Dalla Lana School of Public Health at the University of Toronto. I'm a co-investigator on the Sharing Dance project with a strong interest in how engagement with the arts, in this case dance, can increase social inclusion by supporting embodied self-expression, creativity, and social engagement of persons living with dementia. Sharing Dance uses a narrative approach to dance that encourages participants to express themselves through movements in their own unique way. For example, each movement is introduced in the context of a narrative about common experiences, and it's up to the participants how they wish to perform or express the movements. In this way, the narratives are rooted in feelings and embodied actions. The significance of this is that embodied self-expression in the context of advancing dementia is the primary means of communication and is so central to creativity and social engagement. We saw this in our exploration of participants' experiences. Playfulness and sociability were key findings of our research. We found that participants let go of what's real and became completely immersed in the narrative of a particular dance, often adding their own personal style with sound effects, drama, and even humor. This encouraged connectivity between participants in that they co-constructed and collaboratively animated the narrative of the dances through gestures, movements, and verbal expressions. The program beautifully supports the vitality of persons living with dementia through embodied, playful, and imaginative engagement. And in doing so, it importantly counters the tragedy discourse of dementia and assumptions of existential loss and supports social inclusion.
This project is really special because it's one of the best examples of collaborative arts-based research in one of my favorite areas, which is rural aging communities. And what's really special about it is it's brought together a number of different academics and professional and practice-oriented leaders in the arts field, but also in terms of gerontology, social gerontology, geography, rural aging studies. And it's brought us together to work with older people and their carers and community program leaders who are implementing a really neat and innovative dance program, and brought us all together to try to understand the experiences of those involved in the project, what it means to them in terms of their participation and the potential for their social inclusion, but just as importantly, what it means for the communities themselves that are trying to find innovative ways to support older people. And arts-based programs like Sharing Dance have proven to be a very, very creative and very productive way for us to try to solve a number of problems affecting rural communities across Canada.